All right, everybody. This is Phil Hinton. You live in Fresno, I believe?
Yeah, live in Fresno.
And you visit here, Grover Beach, every once in a while. Phil, how old were you when you became a Christian? I mean, with your full heart, not just born into it, but
22.
What led to that? Why did you decide?
Well, I had been baptized when I was 10, and I meant it then. And then when I got into my teenage years, and all those things that were alluring of the world, especially sex, was attractive enough to me that I thought I'd disregard some of those rules for a while. And in college and first year of medical school, I got...
And that's pretty normal for people.
Yeah.
They disregard the rules and all that.
Pretty far away from the Lord. And then I got to... I was going down to clinics with a group called the Christian Medical Society in San Francisco. I was in medical school. I could tell these people were serious about God, and I'm thinking, is he real or
what
is he
did you
not?
see there that inspired you to think these guys are serious? What were they doing differently?
I could tell that their lives were really right with Jesus, what they talked about, what they thought about,
The way they
what
lived.
they did, the way they lived. I mean, they were nice. They were beautiful, clean, fabulous people.
And that inspired you?
Yeah, well, that was part of it. And the other part of it was I just thought, I grew up, I was baptized, I'd been told about Jesus all my life, and then I was on Army Reserve duty in Arizona. And I was riding along, and I just decided I needed to know. And I said, God, either you're real or you're not. If you're not real, I'm done. If you're real, I'm all in. I really need to know. I heard him speak.
Did you hear it as a voice, like surrounding you, or in your mind,
in
or?
my mind.
Yeah.
I'm here. Not only am I here, I'm going to show you. And I saw in my mind a picture of when I was little, when I was baptized, what I had done wrong, how he had protected me in the meantime. I mean, this probably only took a minute or two, but it was like a 5-hour show. I even saw where he had rescued me out of some really tight, bad situations I'd gotten myself into with drugs and stuff.
Oh my gosh.
And, things were
And you
dangerous.
attributed that to him. When you got out of that, you're like, that was God.
That was God.
But that was before this moment, or that was after?
Didn't see it till then.
Oh, then you realized
Showed
that
it
was
to
God.
me. Yeah.
Oh my God.
I
Wow.
said, okay, I'm in.
And that was the kind of the turning point.
That was the turning point.
I think I mentioned to you that I had a turning point of my own, but as I mentioned, to me, that felt more like hey, this is just the beginning, and I've got to go through some more stuff. For you, was that was it? It was like you've been all in, or was it also like, did you have more things to go through to get closer to him?
Well, always have a few more things to go through, but that basic thing where it hit me right there. And by that time, I'd been married for 3 years and had by the time I really got serious, I was married and had a one child, and my wife just said, "You're different. You're really different. What is it
After
about
that?
you?"
Oh
Yeah.
my! But she knew that you went through that,
Well, I told her about it. Yeah.
and then she noticed the changes.
Yeah.
I want to make sure everybody can hear you. Can you? Okay. When you said you were baptized, what church was that in?
Well, it was called a Christian church. It's the one that was originated by a guy named Elton Campbell. And it basically speak where the Bible speaks, be silent where the Bible is silent. And my mother's father was part of that church, and my mother, and my dad kind of. but the idea there was water baptism if you believe in Jesus as an adult. And so when I was 10, I decided I'll follow Jesus. So I got dunked in the water and came up and had a relationship with Jesus from then.
Amazing.
Even though I was walking away.
What age were you again when you had the that turning point?
Well, I don't remember for sure. I
20
got
something?
married when I was about 24, so this
Okay.
must have been about age 27.
Oh,
before.
27. Now, okay, so you had already graduated undergraduate by then.
Yeah, I knew from my Christian Medical Society experience that there were real Christians.
Yeah.
I just hadn't really bought into it. I'm all in.
Yeah.
At that point, I
Yeah.
didn't really buy all in until probably age 27.
So were you like 22, 23 where did you go to undergrad?
I was an undergraduate at Stanford and then medical school at San Francisco, UC San Francisco.
So at 27, were you still in med school, or?
At 27, I was still in residency. I was in surgery residency, so I was operating already, but
Okay.
training.
Okay. And then you, when did you finally finish with everything ready to go practice?
Oh, not till I was 32.
Okay.
That's when I knew I was old. I had my 32nd birthday, and I said, I haven't even made any money being a surgeon. Here I am, a resident surgeon. I know how to operate. I'm qualified, but I'm poor, and I'm 32. I'm already old.
At that time, was it standard to you got student loans to make it through that, or were you working jobs, or what did you do?
Well, once you finish medical school, they pay you enough to subside on, and my wife was working as a nurse, so between the both of us, we had enough to get along.
That's
so
great.
We're in good shape.
That's awesome. You mentioned to me having some what people might refer to as supernatural experiences that kind of solidified your faith. Did those happen in undergrad, I guess, was it in med school? Was it in residency?
That happened after this experience I told you about at about age 27, riding along in the Jeep saying, if you're real, God, I need to know.
Yeah.
And I had heard from my sister, and I had met a few people in that Christian Medical Society that were full of Jesus and believed in miracles and spoke in tongues and did things like that. And as I was riding along in the car that exact same time when he was showing me this movie, I just said, if that's real, I want to do it. And I saw like a billboard in my mind with words that I could read. And I started reading them. There's nothing from me. It was tongues. And it's like he just shocked me.
In your mind, you saw words.
Yeah.
And you vocalized them.
Just like watching the thing in Times
Captions.
Square.
Oh, okay. Oh, the ticker, like a ticker tape.
Yeah.
So you're reading them off, but you don't know what it means, I guess?
I have no idea what it means,
Gotcha.
except it feels really, really good.
Ah, okay.
And that was the beginning. I mean, after that happened, it's a real fantastic high for maybe 30 minutes.
Yeah.
And then
Oh,
I
yeah.
tell my wife about it. She's like, I don't know. Our church wasn't very big on that kind of stuff.
Oh,
it's
yeah,
like,
yeah.
as for the old days, that's not for now.
Yeah.
But then things started to happen, like in the hospital. I had one of my fellow resident physicians who was a OB-GYN resident, and he came in the hospital. What they thought he had meningitis or something, because he was super sick, high fever, really awful. They even had me do a lumbar puncture on him and get some fluid so we could start treating him if we needed to. And another guy and I, who's kind of like me, decided we'd go in and pray for him. Said, let's go pray for him. So we went in and laid hands on him, and 30 minutes later he was up walking around looking good, and they discharged him. And we said, oh, some of this stuff's really for real. Oh. So we started seeing things that were pretty miraculous.
What did you, at that point, did you kind of feel like, not surprised, like, of course, I believe in God, I know this can happen sometimes, or was that another turning point for you?
I was still surprised.
It's always shocking, right?
It's always shocking. We
astounding.
About a year later, we were having, because we were so on fire for God, we were having meetings in our house, and some nuns were attending, about 5 or 6 nuns were attending, and we'd all pray in tongues together and pray for each other and
do you remember what church nuns were? Were they Catholic? Were they something else?
They were Catholic.
Wow. And they were okay with the talking in tongues?
Oh, they were from our local parish. They and their priest all talked in tongues. As a matter of fact, they were way more bold than us. The nuns would be sitting there and say, hey, let's talk in tongues. And they'd...
Oh, my God. Wow.
Anyway, we're at one of those meetings when one of our young friends, who was probably only about 16, her name was Patty, had fallen and had broken her humerus. And her friend that was with her said, why don't we just pray for Patty's arm? And we said, wow, okay, why not? And she had one of those casts on it, hanging arm cast, and painful, and it was only a day or two old. So I said, her prayer was like, hey, God, why don't you heal Patty's arm? And Patty says, my arm's getting healed. And she started waving it around. And I reached over, here I'm the doctor in the group, right? So I reach over and grab hold of her arm. I can feel the bone forming. I can feel the thing healing. When bones heal like that, they get a big, thick part around them, and then as it heals up, it goes away. I felt all of that, lasted about 2 minutes, and then she just did this with her arm. And I said, Patty, don't do that. Go to your doctor, let them take the cast off. And of course, like I said, it surprised all of us. But it was real. I felt it. I saw it. I saw the callus, felt the callus form. So, now does that work for everybody? No. People at the hospital, word got around that if you asked me and a couple other people who were on fire like that, because I'd met a couple other resident doctors who were like me. They were nuts about Jesus and believed in healing. And so they'd say, well, you go pray for so-and-so. And most of the time we would, but one of the guys they asked me to pray for like that, it was like I heard the Lord say in my mind, no. And I said, it was the telephone operator that asked me to go up there. I said, I'm sorry, I can't do that. And why not? I said, because I believe God told me no. I don't know why. I don't understand all this.
Wow.
He does what he wants to do.
Yeah.
So.
Like, a lot of people just think in terms of like, oh, okay, God is there for making my life better and healing. But if some people look at the New Testament when Jesus was healing people, and a lot of people view that as more like, yes, he healed people, but his whole point was like, hey, I'm doing this to prove to you that I'm legit. Like, do I have your attention now? Now that I have your attention, understand, there's more at play here. Let me tell you about being saved, the gospel, all the things.
Yeah, they'd asked for a sign. You said, you've already got enough signs. You got what happened, you got Moses.
And so that, and the theory was that back then he did that, and so there didn't need to be any more miracles. That's what the cessationists believe, right? It's like there didn't need to be any more miracles because his message is out there, and everybody, and it's fine, and it's spread. Well, you look at the way the world has gone, the message kind of declined. People got weaker in faith, the church got weaker. Sometimes it feels to me like Jesus said, he rolled up his sleeves and he has to come back through his disciples, like people who follow. It says, all right, we got to show them all over again. And to me, that's like some of what you experience. It's like showing people like, hey, God is real, Jesus is real. Yes, it's amazing that you're healed, but look beyond that and have faith. Because it feels like Jesus always said that, like, yes, you're healed, but now go and sin no more. Well, go and sin no more and have faith.
Yeah, the healing, you're right. The healing's not the point. The point is he's real. Yeah. He wants you. He wants your life. He wants to be in you. As a matter of fact, as we had a bunch of people that were attracted to us because of all of this, and so the three of us from the hospital, and I don't know, at our house we probably had 25, 30 people gathering on certain nights of the week, and after a while, some of that stuff, like the speaking in tongues and the miracles and stuff, it was almost like a game. God will do this on command, and he turned it off. And it was like, none of that's happening.
Enough, yeah.
And we all looked at each other and said, okay, this is not a game. He does what he wants.
Yeah. Yeah, it's not. We're not just there for the titillation of the experience. It's like, you should only need that a few times until you're like, okay, I get that he's there.
Yeah.
And it's like when somebody's healed, if they're like, oh, great, I'm healed. It's like, that's not the point, guys. Like, the point was now have a relationship with God. And it seems to me like people can eventually get to the point where it's like, okay, like, I'm good with whatever. Like, and if he does heal me or get me out of trouble, to me, that's just a testament of like, God, you didn't do that to be nice. It means you have something else for me to do.
Yes.
And I want to find that.
Yeah, there's purpose.
Yes.
One of the serious things we did was we cast demons out of a girl who'd been gang raped and who was just really messed up in her head, and she started coming to the group, and basically we found that out, and we spent an evening, and she was well after that.
Oh my God.
And so, but we didn't go looking for that. That was not pleasant. That was not fun. It's not something we wanted to do. It's just something we felt like we had to do.
Wow. And did that have a lasting effect on her?
Or? Yeah, she's still doing fine.
Oh my God, still doing fine.
Still doing fine.
That's amazing.
Yeah, and that was probably, when that happened, that was probably 1974, 75, and she's fine. She even changed her name. She She had a nickname that she had taken from those days when she had been hurt by gang rape from soldiers and stuff, and so she even changed her name.
That's amazing.
Yeah.
It seems like when you're younger in your faith or have none at all and you get those healings or God gets you out of trouble, that's building your faith and you're like, okay, God still has a plan for me. But if it ever gets to the point where God's like not getting you out of trouble and maybe you're coming to the end of the line, it's almost like that's a signal of like, I guess he has nothing else for me to do. I just got to relax and cross over wherever he wants me to go. You know, you can be at peace with that kind of.
I think so, but I also think you never run out of things for him to do with you. All you got to do is be alive
That's
to what he's doing. And there are times when I say, Father, what are you doing? Other times it's like, oh, I see it. There it is.
Oh yeah. That's a great feeling. It's great to witness.
But I don't think you ever get too old for that. I think God keeps your, long as you're willing to stay open to Him.
It's got something for you to do.
He'll keep giving you places to, people to talk to, things to do.
If I remember correctly, you eventually got into vascular surgery?
Yeah.
Okay. And was that your specialty? Like basically, I don't know how it works in medical school, but you specialize in that? That was what you trained in?
You specialize in medical school. You have 4 years where you get all your basics and you decide what you want to do. And then after 4 years of medical school, 4 years of college, 4 years of medical school, and then you choose your specialty. And I chose surgery, and I had never intended to go into surgery, but in medical school I found that I loved OB and I loved surgery. I loved both of those things. So my wife and I was married in medical school, and so my wife is a nurse, and we talked it over and decided I'd do a surgical residency, because with that you can do almost anything. You can do family practice if you want to, but you can operate if you want to, you can do anything. So I did a 5-year surgery residency. It was part of University of California, San Francisco, but the program was in Fresno. And when I finished that, I spent 2 years teaching at that campus, at the Fresno campus, and what I was teaching was trauma surgery. So my block time was the middle of the night. Like, when block time is the time you're assigned when you get to operate every time. And so my job was to catch the worst people who came in with the bad trauma and try to save their lives, and I was training the resident doctors, resident surgeons to do that. And it's something I love, and something I had a good time with. And after a while, that gets wearing on you. It's like every night, middle of the night, emergency stuff. And so I decided,
like seeing people go through these traumatic things.
I go into regular surgical practice, and so for 2 or 3 years in Fresno, I did gallbladders and appendix and abdominal surgery, stomach cancers and chest surgery and some vascular surgery, because I'd been trained to do that. And then with time, I was just too big a load and too many things to know about, so I quit doing general surgery and did just chest and vascular. So I'd take out lung tumors and things like that and repair arteries and veins. And then that got to be too much, and so I moved to just straight vascular. And by that time, vascular, this was around probably 1980, vascular was becoming a subspecialty of surgery in its own right. And so I would go away and take courses here and there to learn what anybody knew about how to do other techniques in vascular surgery I didn't know. And from then till now, that's all I've done. So just vascular.
Did you stick with that because you just liked it? You liked the techniques and that field?
Loved the people. You're in the business of preventing strokes and saving legs. And so, one of my favorite cases, I still take care of the daughter of the woman that I did. They were getting all set to amputate her leg. She was about 74, 75 years old, and she had bad enough blood vessels in her legs that nobody would take her on. And they brought her to me because I was supposed to be the young hotshot that would know how to do stuff. And there was a relatively new technique at that time called in situ arterial bypass, where you leave the vein in the leg in its place and connect it at the top, and you can go all the way to the foot with that bypass. And so I told her I thought she was a good candidate for that. I couldn't guarantee anything, but I'd like to do that, and I thought maybe it would benefit her. Sure enough, I took the bypass right down to the top of her foot, tied it in down there, the foot pinked up, looked good. She was good till she died about 10 years later.
Good job.
And I take care of her daughter now, and every time I see her daughter, she says, "You remember my mom?" And I said, "I never forget her."
That's amazing. Oh, wow. And it's my understanding that you're still active in that field.
Well, I'm not operating. What happened with my career was that in about 1996, I was still operating and very active. I had a group of 4 of us that were doing just vascular surgery. By that time, I was senior partner of the group, and I had gathered 3 younger partners who'd actually been fellowship trained. They'd done everything I'd done, and then 3 more years of vascular surgery. So they're more trained than me.
Wow.
So I had a good group going.
That's a good feeling when your students
Yeah, it was.
grow
Yeah.
almost beyond you in some ways.
Well, they were beyond me.
Oh, wow.
So then our hospital system there, it owned 3 hospitals. It's called community medical centers, had a bad experience with the chief executive officer. And I was on the board because I was one of the senior surgeons, so I was on the board of a not-for-profit hospital. And they needed a temporary CEO, somebody to head the hospital up, and asked me if I'd be willing to do it. And I said, well, I'm willing to do it for a while if you can pay me about what I'm making as a vascular surgeon, and we'll see how that works out. Well, I went on for 10 years, so I was the CEO of this 6,000 employee hospital system for 10 years.
How did you like that shift from on the job, getting your hands dirty, literally, to now the kind of the business side in a way?
Yeah, it was scary and fun.
Did you feel prepared for a lot of the, I don't know, the business side of that, or did you kind of?
God had prepared me.
Amazing.
I had been studying, taking all the courses that anybody else would take for an MBA, and so I was.
Before you turned
Yes.
to CEO, what led you to take the courses? You were kind of thinking about going that direction, or
No,
just
I just-
curiosity, or
Curiosity,
you were interested in business?
something to learn,
Wow, amazing. So that's serendipity then.
and some interest in the academic side of medicine and the business side of medicine, but certainly not for a hospital system. I wasn't thinking CEO.
Oh, okay.
But I remember the day that the board said, yes, we want you to be temporary CEO, because the hospital was in trouble. It was failing financially. Nurses were feeling bad about everything. And
Morale.
the morale was low, and it was pretty bad. And I was praying about what I was supposed to do, and I went to our biggest hospital, the community medical centers downtown. Started at the top floor on the 10th floor and visited every person I could find in the hospital from the 10th floor through to the second sub-basement. I spent the whole day doing this.
Employees, patients, or
Employees, anybody, patients, mostly employees, and telling them, we are going to succeed. We're going to make this the very best place for patients and for you that it has ever been. And I know you're not getting paid enough now. I know your morale is low, but we're going to fix that. I'm not going to be able to fix it immediately, but we're going to fix this together, and this is going to be a place you are proud to work. Hang in there. We're going to do well. And I took that message from the top to the bottom, and when I walked out of the second sub-basement and back up to the first floor, was another time I heard God talk to me, and he said, well done. And I was high.
you felt like you did the right thing?
I was high.
Wow.
And we had 3 or 4 just fantastic years where...
Oh, so it went well. It started the trajectory changed?
Put my whole heart into changing the morale. We developed a thing called the My Mom standard. Take care of this person like it's your mom. Every patient. And if you don't like your
What
mom,
you called
pick
it, my
somebody.
mom.
The
You called
My
it-
Mom
The
standard.
My Mom, the My Mom standard. Treat them
Yeah.
like wow.
Yeah, the courtesy you'd give your mother, the tenderness you'd give your mother, the safety you'd give your mom, how clean you want the place, how good you want their tests to be, how much you want to trust their doctors, all of that, all together, do that.
And what you say? You say if you don't feel that, then
Well, leave.
yeah.
I had within 3 months I had like 3,000 T-shirts printed that said I love my job at Community Medical Center. I said, now you can't come get one of these. I said, we're going to give them to you. But you can't come get one unless you mean it. If you don't mean that, just leave now. But or just be sullen. But if you really mean it, you can have one.
Oh, nice.
And so there were, I love my job, community medical centers all over town.
Wow.
It was fun.
That's an amazing story, because sometimes you hear about gung-ho CEOs that step in and say that they're going to do something, and then things get worse. And it's just so sad. People end up getting bitter towards like the business types or whatever. And so that's amazing that
within 6 or 7 months, our finances had shot up high enough that we could do a 20% increase for all the nurses. Wow. And it didn't necessarily please the board, because here I am spending the money we're supposed to be making. But I thought, we're a not-for-profit hospital. Where else should it go?
That's amazing.
So, got a good time.
Oh, that's amazing.
But I guess what I meant to say with after all of that is once I left that job, and I spent a year riding my motorcycle, just screwing around, and then
after the CEO job.
Yeah.
Really? You took a break for a while and
yeah. And
where'd you go? Like just around
everywhere.
Fresno, or like travel the country?
Up in the mountains, not around the whole country. California.
California.
Short place. Any place I could ride in a whole day while my wife was working.
Okay. Day trips. Day trips.
Day trips.
What is that something you'd always wanted to do?
Yep.
And you said, now I have a chance.
Yeah, it was either that or fly. I told my wife I was
Like
a
private
pilot when I
Oh
was
my
a
gosh.
kid. And so I told her, well, once the kids are out of the house, it's either going to be an airplane or a motorcycle. And she came home one day and found a motorcycle in the garage where I bought a $1,000 Suzuki from a lady. I didn't know how to ride it, but I said, if you'll ride it home, I'll buy it from you. So she rode it to our house, and I took her home. And here's this little red Suzuki motorcycle.
What was your age at the time that you decided to get into motorcycling?
Let's see, I was
more or less
67 about.
How's that gone for you so far?
Oh, I loved it.
You still
Yeah.
have one? Wow.
Well, I don't have a big bike anymore. I have a little scooter. I have a 150 Honda now. But
Wow.
and I don't ride a lot. I ride electric bicycle more than I ride that. But for several years, for at least 10 years, I rode a big BMW 1200 RT that I absolutely love. Anyway, a year into riding this motorcycle, my partners called me, and they said, "You can't be a bum."
Your partners? Oh, from the old place that you were running?
My surgical partners.
Before the CEO job,
yeah,
the group that you formed, they called
group
you.
I started, yeah.
Okay.
They called and said, you can't just hang out, be a bum like this.
Be a motorcycle guy.
And I said, well, why not? They said, because we need you back at work. Come on back.
What did they say about that? Why did they say they felt like, did they feel like they needed leadership again, or they missed you, or it was they wanted to, I don't know, were they worried about your motorcycle riding? What?
I don't know. I just think they needed another person in the practice and wanted me back. And I said I won't operate, and I won't take call. And they said, we don't care. See the new patients in the office and send them to us if they need something.
Okay, help us run the place.
Come back to work. And so I did, and that's what I've been doing since, and I love it.
Did you do that because, did you feel like, okay, they're asking me, if they're asking me, I'm going to go? Or did you also kind of feel that it's like, yeah, I'm ready to go?
Oh, it was right.
It was a good time?
It was right.
Okay.
And it's God stuff.
Good for them, good for you. It all worked out. Okay.
Yeah, good for everybody, good for my patients. My patients I'd taken care of for 20 years came back to see me. Nobody, certain people only want to see me because I was careful with them and talked to them and know them. And,
I'll never forget a little tidbit of advice you gave me when early on when I met you. I think you said smoking is terrible for arteries and veins. It just hardens them, and I'll never forget that.
I mean, if you look at our patients in the vascular surgery practice, it's people who smoke and people who have diabetes, and especially that combination is deadly. And so,
that's sad.
Don't smoke and stay skinny.
Watch the blood sugar.
Yeah, I mean, you can't necessarily avoid diabetes, but you can certainly avoid the complications.
Well, type 2, they say, is a little more, can be manageable with the right foods and all that.
But the main management is stay skinny. And that's hard to do. But the people who do it,
they do well.
Do great.
You mentioned kids by this time. You said they're all out of the house. How many kids did you end up having?
We had 3 kids. We had a daughter first, Susanna. And she, the best thing of all is that all the kids follow the Lord. Okay?
Was that natural? Do you attribute that to them witnessing you and your wife being in the church and happy people? And so, like, I don't know.
Ed, I have no idea.
You were blessed.
Yeah,
with good kids.
I don't think you can say that because we have a lot of friends that raised their kids the way we raised ours.
They didn't necessarily follow.
In the church, and they make their own decisions about what they're going to do.
Yeah.
But you know, the rules that Kathy and I had for our kids was real simple. It was if we can defend what we want them to do from the Bible and from what Jesus taught, then we'll demand they do that. Otherwise, we don't lay heavy rules on them. So, you know, they had a lot of freedom. We didn't try to tell them what to think. We wanted them to go to church. We encouraged them to know God. We did all that kind of stuff, but we weren't hard-ass people. We just weren't. So Susanna was our oldest. She eventually became a teacher, and after she taught at the local Catholic high school for 3 years, she actually taught catechism, even though she's not Catholic. She was best at it. So
That's funny.
They had her teach government, catechism, and a couple other things. She came to me and said, "I know you've spent a fair amount of money on me, Dad, but I'd like to become a lawyer." And I said, "That's a great idea. Why don't you apply?" So yeah, she did.
Oh, that's great.
And she's a lawyer for State Farm. She lives in Illinois, just south of Chicago, at State Farm headquarters. Has a husband, 2 kids.
What took her to Illinois? Her husband, or?
No, it's State Farm headquarters.
Oh, okay,
So
okay.
It's a
Her
good
job.
job for a lawyer.
Gotcha.
Her first job as a lawyer, she's making this much money, but she's working this many hours too.
Oh, yeah.
And so after 5 years of that, she went to work for an insurance company so she could work 8-hour days.
I moved this way because the wind is coming in. I think
Oh,
I can block it a little so I can hear you better.
No,
Okay.
that's fine. Anyway, then our second one, 3 years later, was Sam, his son, Samuel. And he was going to become a mathematician, and in his third year of medical school, in his third year of college, heard God tell him, you're supposed to be a doctor.
Wait, so he's an undergraduate studying mathematics.
Yeah.
That's his passion.
And
then
fabulous at mathematics. And here's God
he had a
telling
passion
him-
for that. Okay.
Here's God telling him,
Go to doctor route.
go to
Really?
doctor route, yeah.
Wow.
And he is married to a girl that he started going with when she was 13 and he was 14.
At the time they were married?
When they got married when he was about 20 and she was about 19, you know,
Yeah.
that kind of age.
Yeah.
But when Sam and Don met, they were still she was in junior high and he was in high school, 14 and 13. And they never really dated anybody else. Sam had one time he took another girl to a dance, but that was it, besides being with Don.
Yeah.
And one of the most fun things I overheard from him was when he was 16, I overheard a telephone battle he was having with Don. And I said, "It sounds serious," after they were done. I said, "It sounds serious, Sam." And he said, "Oh yeah, it's a serious fight." I said, "Well, does this mean you're going to break up?" He said, "No, it doesn't mean we're going to break up. We're going to get married." He says, "Don't you and Mom fight?" And I said, "Yeah." I said, "Good lesson." Anyway, they got married. So Sam did go to medical school. He's an eye surgeon. He's an ophthalmologist, and he has 3 kids, and he's the only one of our kids that stayed in Fresno.
Oh, okay. He's still there?
Yep,
Oh, amazing.
still there, and it's kind of fun because sometimes they ask me, "Do you have a brother who's an ophthalmologist?"
No way.
Or they ask him that.
Is that because of the last name or the resemblance?
Last name. Well,
Oh.
last name and resemblance. We look a lot alike. Of course, he looks a lot younger.
I wonder
than
if
me.
he kept his interest in math on the side, just read up on
yeah.
it. And...
Oh yeah, he's still a math whiz, and
Oh,
his
cool.
second son Max is a math whiz too.
Amazing.
Then we were at 10 years later. I was 41, and we hadn't decided whether or not we wanted to have another child, and Kathy was pregnant. So, we have 10 years between the second one and this one, and that's Stephen. Yeah, I thought we were going to have a little girl. We had a little boy, and Stephen is one of the things about him is he kept us young. I mean, really
Starting all
did.
over.
Oh, it was fabulous.
Starting all over. Wow.
Starting over and having a young one. And they asked me when he was at school, "Are you the grandpa?" I said, No. It's my son. And but I mean, he was one that that encouraged us. When he was 12, he wanted to learn to scuba dive. So he said, okay, we'll all learn to dive together. So we all certified divers when he was 12. And
he was the one who instigated that?
oh yeah, he wanted to dive, and anything he wanted to do. I mean, by then he's the only child. The older two are out of the house. They're doing their own thing. We got us and him, and we did all kind of stuff. Went to Italy with him. We did lots of stuff. Anyway, he eventually went to medical school, and he is an ophthalmologist also. But where he went to medical school was in Texas, and when you go to medical school in Texas and you meet a girl in Texas and she's from Oklahoma, she wants to stay in Oklahoma. And so they live in Kansas, and he's an eye doctor in Kansas, and they have 2 little girls and one that's almost here. In 1 month they'll have a new baby. They don't know if it's a boy or a girl.
That's amazing.
And like I said, all 3 kids tight with the Lord, and we're so happy about that. I mean, raising their kids in the admonition of the Lord doesn't get better than that. Kathy and I have talked about that a lot. We consider that huge success, and we don't try to attribute it to us. We just say, thank you, Jesus.
Amazing.
Yeah.
Oh, wow. Oh my gosh. When your third son became the ophthalmologist, did that have anything to do with his older brother being that? Was he inspired by that?
Yes.
Or? Okay.
Yes, yeah,
Was it? Would you think it was like just talking to him and seeing him? He said, "Oh wow, I think that's cool." What do you think? Was it?
Wow.
Did he see The Office and think that was neat, or what do you think it was?
Wow. I mean, here he sees me. I'm a vascular surgeon. I am a gung-ho guy, and I love what I do.
Oh, you have a passion for what you do.
And he sees that one Christmas when he was 4,
Yeah.
Stephen, the youngest one Christmas when he was 4, I got a call 2 days before Christmas at 11 o'clock at night. And the call was, there's been a highway patrolman. He was shot out by Los Banos, and we need you now. The bullet, he's bleeding inside. So I go to St. Agnes. That's not the hospital where I was CEO, but another hospital in town where I was chief of surgery. So I go in, and I spent 3 days at the hospital trying to save this guy's life. I lost him. I couldn't save his life because the bullet had gone through the artery, the aorta, and the vena cava, and the colon, and the back, and the spinal cord. I mean, he was a mess, but I just was determined to try to save him and stayed there. And so Stephen had witnessed the kind of work I did, which was when stuff bad happens, Dad disappears, and he might disappear for 3 days. That's the kind of thing. And then he watches his brother, Sam. His biggest emergency is he might have to go in once every 6 months to take care of a ruptured eyeball. Right? Maybe. But it's surgery. It's nice, clean work. It's nice, touchy work. It pays good, and you don't have to work like that. So I think that's kind of why.
Okay.
And they both love doing eye surgery. And they both hate the idea of delivering babies. And I loved delivering babies.
Oh my gosh.
Just differences in people.
Yeah. Did you say you got? I'm sorry for keeping you so long. Thank you. I appreciate it. Before we go though, did you say that did you ever get into teaching at all?
Oh yes.
Okay.
Always. I taught a lot of different ways. Medically, I taught resident physicians because our group was part of the University of California, San Francisco. We were all, they called us clinical professors or associate clinical professors of surgery.
Yeah.
And so the resident physicians who were in surgical training were with us in the office, with us in the operating room. They'd do part of the case under our supervision. And so almost all the cases, they got to do some part of it. And depending on their level of skill, they might get to do all of it when they're senior surgeons with us watching them. And so I taught a lot that way, just direct teaching. I also did a lot of lecturing to medical students that came from UC San Francisco for a rotation to Fresno, teaching them how to do an arterial exam, how to use a Doppler, how to make a fairly quick decision on whether somebody's in trouble with not enough blood supply to their feet. The small tricky stuff for vascular surgery that experience, you can tell them this is what you look for. Then I also taught at Fresno Christian High School. I thought I thought it would be beneficial to the kids. So I talked to a couple of the teachers, and they agreed. And I taught some, not like I was teaching all the time, but I come in for a day every week or so for 3 or 4 months, and teach things like the basics of biochemistry, or the basics of why. I don't know. The big thing I was about was that abiogenesis is all the rage now, and has been for a long time, that you don't need God, life just happens. Well, in fact, if you're a scientist, life doesn't just happen and can't just happen. And the same thing is true with evolution. So I told them, don't go trying to buck all the scientific dogma that's there. Just know that the scientific evidence does not support it. And so I taught quite a few different subjects at a high school level for about 3 years, not a long time. Anyway, I've been teaching all my life. So
That's amazing. So you eventually decided to write a book, I think.
I did.
Tell me the title again. What every college student should know, I think. Should know about Christianity, something like that. Yeah.
It's called Going to College, ? Questions every Christian should be able to answer.
That's right.
Going to college, questions every Christian should be able to answer.
Yeah.
And I wrote it during that time I was teaching at the high school.
Did that inspire you? Was being around the kids and the questions they were asking?
It inspired me as I was taking a shower, and I heard the Lord say in the back of my head, write this stuff down.
Oh, okay.
Okay.
And did you have it with them in mind, like kind of
Yes.
Because you're high schoolers, they might be going to college, and so
Most of them do go to college.
yeah.
And I wanted them to know that they shouldn't don't go yelling about it to buck the system. Just know that if you really look at the science, this stuff doesn't hold up. I mean, even one of my favorite authors, it's a 2012 book. He's an atheist guy who just says, the title of the book is Why Abiogenesis and Evolution Are Almost Certainly False.
Man, we're going to do a whole other video on just that topic, I kind of feel like, because that's definitely a deep topic. I think
it's a good topic, too. I mean, scientifically, it's a great topic to talk about, because there is no good scientific evidence that life can happen by chance. The evidence is exactly the opposite, that it can't.
Do you mean as far as like life forming on Earth in the very beginning, or do you mean more like conception and stuff like that?
No, I mean life forming on Earth at the very beginning.
It's not just a matter of amino acids or whatever combined.
The origin of life.
Yeah.
Life from no life by chance is not just statistically improbable, it is statistically impossible. And most origin of life scientists, probably the vast majority, know that. But because they don't have any reasonable alternative, they stick to that story.
Yeah.
It's politically incorrect to not stick to that story.
Not good for funding, etc.
Yes.
Well, and I have seen a lot of scientists who have faith who say, hey, look, science is just a tool. It helps us introspect into how things work, but it doesn't always explain everything, you know? And so I think that's a kind of inspirational message I've seen from a lot of science folks. Like I said, that maybe someday we'll do a whole one on that, because I think you know a lot about that topic. And I already kept you long enough. But well, before I close it, is there anything you want to say to anybody out there, young people, or anything at all before we sign off?
Take a chance. Ask Jesus if he's there. See what happens.
Can't go wrong with that.
No, you can't.
And don't stop asking.
No.
Yeah, ask more than once if you need to. Well, thank you for your time, Phil. I really appreciate it. That was wonderful.
Yeah.
Finally, got deeper into some stories I'd never heard, and but thank you very much for sharing that with whoever watches this. All right.